Welcome to the Coffee and Counseling Podcast, where two licensed psychotherapists give you their unfiltered opinions on mental health, wellness, life, and everything in between. It's real, raw, and ready to challenge what you think you know. Get ready for some tough love. Before we begin, just a brief disclaimer, this podcast is for educational and informational purposes only and does not take the place of therapy. We hope you enjoy today's session. Hello, everyone, and welcome to today's session of Coffee and Counseling, where we don't spill the tea, but the coffee will be piping hot, where we talk about all things counseling. We're your hosts, Rachel Steinhardt
and Stephanie Van Schaick, and today we are diving into a very big and very important topic, and that is trauma. What it is, what it isn't, and why understanding the difference really matters when we talk about healing. Before we get on into that, Rachel, what is one high and one low for this week?
Okay, guys, don't even get me started on my day when I'm talking about lows, because I literally can't, Steph. It's been a day. Essentially, I went to get my baby girl her passport, her first passport. Yay, so cute. We love that. And it was so funny. I went to get her passport picture yesterday. And the guy with this, I guess this is my high. So we'll go with my high first. I went to get her passport picture yesterday, and she smiled for it, and she was so cute. But the guy was like, I'm really scared that they're not going to take this, because a lot of the time they just need you to have like a straight face. So he's like, can you try and get her to get a straight face? Mm-hmm. So we ended up having both. And the guy was like, the picture is so cute of her. I'm just going to give you both and like only charge you for one. And by the way, passport pictures are crazy expensive. I don't know. I didn't know this. Like, it's so tiny, and you get like 2 copies of it, and it's $20. Mm-hmm. It's insane. And like the world,
usually not even a good photo, because you have to be like all like mean mug, basically.
Photo, but whatever. It's just like, now I have this adorable. He was like, in the event that they say this is acceptable, like at least you'll have like the smiley picture of her. Like, imagine you have, a smiley picture of your baby's passport. I'm like, yeah, that's pretty cute. So that was my high. It was just like, it's always nice, to encounter like just sweet people like that. Yeah. And I was doing that with all 3 of my kids. So it was pretty nutso. And he was just very kind and patient. And I was like, thank you, sir. Like, thank you for not making this harder on me. So I guess that was my high. But then today I had to actually go in to the courthouse, whatever the heck it's called. And you guys, it's so hot in Florida right now. Like, the minute you step outside, it feels like an oven. And all my mamas out there, you know what it's like when it's already just such a schlep to bring your bag and then the baby's bags and then all the extra stuff, and then go to the back of the car and pull the stroller out and put all the pieces together. It's just such a to-do to like get a kid in and out of the car. So I get there, I get her out. It's also, by the way, a half-hour drive from my house. And I finally make my way in. I'm like pulling the stroller up the stairs, like sweating, exhausted. By the time I get in there, I feel like I'm going to pass out. Mm-hmm. And I wait on the line. I finally get to the front. It's finally my turn. And the woman goes, you're missing a notary signature. I can't do this for you today. She goes, if you get me a notary signature by 4, like, you can come back and get it done. And I'm sitting there thinking, okay, all I want to do right now is go home and like hydrate and like relax, because I don't know why this little event just took the life out of me. But I was like, no, I am determined to get this baby a passport today. So I'm like, okay, what do I do? So I'm like thinking, okay, I'll go to the bank. There's always notaries at the bank, and I'll have the bank notarize it. And so I get my kid back in the stroller and back in the car and do the whole, it's also like there's no parking. So you have to park far away, which is why I was so winded and it was so hot and I was so dehydrated. And I go back and I'm like, I'm doing this. I'm determined. I drive 10 minutes in an opposite direction, get to the bank I need to go to, get it notarized. I'm like so excited. And the banker guy was like so sweet. And he's like, oh, okay, just make sure you sign here, whatever, you did it, great, okay, good luck. I get back in the car, pack everything back up, drive 10 minutes back again, go through the same thing, take her out of the car, find park, I get whatever. Second time, I finally make my way in there, wait on an even longer line, finally make it to the front. And the woman goes, why is your name signed here? And I'm like, because this is where the parent signature is. And she was like, no, 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 it's only supposed to be for the parent that's not like here, which is your husband, but like you're here, so you don't need to sign this. And I'm like, but who cares? Like, she's like, if you weren't here, it would be fine, but you are here. So I was like, do you understand that that literally makes no sense? Like, if there is a place for both parents to write their name and sign and have it notarized, who cares if I did my, like, filled out my section? I don't get it. Like, it
Mhm.
literally made no sense. And of course, a lot of the people that work in those offices are not the nicest.
Bureaucracy. Yeah.
It was so obnoxious to me. And I literally looked at her when she said this to me, and I, like, my voice was choking because I was really about to start crying. I'm like, please don't do this to me. Please, I'm begging you. Just like take it, just take my name out. She goes, we don't do that, ma'am. Like, you need to redo this. And I'm like trying not to cry. I'm like, Rachel, hold it together, hold it. And then she goes, and by the way, you told me you didn't bring a checkbook with you. You can't pay with the credit card, so you can't do it today anyway.
Oh my
And I
God.
just hold my breath and I'm like, okay, thank you so much. Have a nice day. And I'm like slowly walking outside and I'm like, Rachel, don't cry, don't cry, don't cry. And these are really the moments that I'm just so thankful that God is a part of my life, because as much as I really thought I was going to have a mental breakdown, I was walking back to my car in the 100-degree weather and I really didn't feel well at this point. Like, I felt like I was going to pass out from how many times I went in and out of the car and walked in the heat. But I just really said to myself, like, if this is what God wants for me today, then I accept it with happiness. And like, this is what was meant to happen today. And truly, like, that got me through the rest of the day. And I'm just so grateful to have that, to have that mindset and to have that tool, because I really think I would have just like fallen to the ground and started crying. I don't know if I'm being over dramatic, but like in the moment, it was so like heart wrenching when
Mm.
she was like, no, you still can't do it. And I'm like, I'm being punked. Like, where's Ashton Kutcher? I'm being punked.
Well, it's like the straw that broke the camel's back. It's just like one thing after the other, and it's so frustrating because you're right. A lot of times, the people, and not everyone, but a lot of times the people working at these agencies, I don't know if they're under a lot of pressure or they deal with a lot of craziness
Of
that they just,
course they do. I mean, they have a very hard job. I feel for
yeah.
them. I really
So
do.
it's really
But
tough. So
it was frustrating, like also had to take the whole day off to get that, like, whatever, a lot of pieces, but that was definitely my low.
yeah, I'm so sorry to hear that. And but lo and behold, you're here, and that's great. Are you planning on going to Israel like soon? Is that why?
First of all, like, ever since the war started, I think a lot of Jews have felt this way, that like we should all have, it's so sad to say this, but like everyone's just like, you need to all have like your papers in order in case, God forbid, you need to flee the country,
Mm,
because that's the point that we've reached. Like, everyone feels so unsafe, even here,
mhm.
that we want to make sure that if we needed to pick up and run, that everyone has the proper paperwork to do that. And like, it's so insane saying that, but
Yeah.
that's the reality of our life right now.
Oh, wow.
um so really, it was just for like safety reasons of making sure that all of my children have the proper paperwork, if
Mhm.
God forbid it ever came to something like that.
Yeah, God forbid. Wow, I'm sorry to hear that. That does sound really, really intense. For anyone going through that, in your community, that's really awful to ever feel that way. So, um,
Thanks, Steph. You've always
hopefully you'll
been such
never need
a
it.
huge supporter and advocate, so I really appreciate it. But
Of course.
let's please switch topics. Tell me about your high and low.
Okay. Well, I've been remiss first and foremost. I forgot to mention and make sure everyone is getting their coffee and getting ready for today's session. So make sure everyone, you grab your coffee, grab your cute mug, whatever you need to do, coffee, tea, whatever, and get started with us. So my high this week was that I went back to New York and I got to see my sister, my brother-in-law, my nephews, and that was really, really exciting. I got to see some friends as well, which was really nice. And I haven't been there since December. So it's been quite some time. But my sister, nephews, and her family and we had a blast. So it was really, really nice. And the low would be that I really miss them. And, leaving is really it's really tough, and I wish that all my family and my loved ones were in one area, but
Yeah.
that's not the case. And, it's always sweet, though, being able to see them. And I know my sister listens to this podcast. She had a lot of good feedback for it. And so, hi, Laura, whenever you're listening to this. And yeah, so that is, yeah, she'll be like, "Oh my gosh." But yeah, that would be
What a
my
shout
low.
out.
I know. She got a shout out. Like, you're so very special. I love them. So I'm hoping that she does feel special. So
That's so amazing. Did you do any
yeah.
like specific activity in New York that's like New Yorky that you really enjoyed?
Not really, no, it was so busy. My
Yeah.
nephews are involved in a lot of sports, so I was able to see them playing, and I really miss that because that is
Aw,
one of the top things that I miss from living back there, because I would try my best to go to as many games, practices that I possibly could, and
those
supporting
are
them and
fun.
cheering them on. Yeah, they're good too, so that's always fun too. But yeah, no, I wanted to get a couple. Normally, whenever I go back, I'm like, okay, I need to get pizza. I need to get TJ's Heroes for
I
anyone
need
on
to get
Eastern Long.
pizza.
Yeah, anyone on Eastern Long Island, you know where that is. And
That's
also,
way to Jews and getting Chinese food in New York because the ones here, I'm sorry. I'm sorry, all the restaurants in Florida. I love you, but like there's just no comparison to the kosher Chinese
Chinese
food in
food.
New York. So
Really,
I hear you.
yeah.
I get it.
Yeah, I'm not a huge Chinese food person, but I know that whenever I do, New York's is superior for that. I mean, I find a lot of great food around here, but there's just a couple
Yeah.
things that it's like,
Oh, 100%,
yeah,
100%. We do
you
certain
gotta have
things really well. It just
yeah.
depends.
Yeah. So next time I do plan on hitting some of those spots and some diners too. I really like the diners there. It's not as much of a thing here. Is it by you? Like diners?
So kosher like establishments, we don't really have diners like ever. It's
Oh,
not a thing.
okay.
So I don't know why that is, but just like the concept of we don't really have that. I mean, we have like very chill, relaxed setting type of eateries. They're just not
Mhm.
diners.
Interesting. Well, you learn something new every day. I didn't know that.
Yeah,
Um,
I mean, the closest thing, I don't, this is probably, no, it's not even a good comparison, but like, because, we don't mix meat and dairy. So you're either going out for meat or going out
mhm.
for dairy. So I guess like anything that you could, like diners are their breakfast, lunch, and dinner, right?
It depends, but yeah, most of the time, well, the ones that I've gone to, it's usually like 24 hours, but some of them could be only
Yeah,
like breakfast
no,
and
we
lunch.
really don't have anything like that. I was gonna say like, oh, maybe we could compare it to like a dairy place that does breakfast, lunch, and dinner, which we have
Mhm.
those, but like they're not diners like the
Yeah,
restaurants. So
they're
I
just
don't think
different. It reminds
that's
me, and then we'll move on to our session. But one time, Rachel, I don't know if you remember this, I felt so silly because I guess I just didn't put it together, the kosher part of it. That one time we went out, it was out west Long Island, and it was a kosher bagel place. And I asked for, at that time, I got this recommendation having
oh my gosh,
chicken salad.
remember I took you to Bagel Boss, you guys. I took Stephanie to
Oh,
Bagel Boss.
yes.
They
Yes,
just
that was
opened one here near my house. It's amazing.
really. Oh, wow.
We're
Okay.
very excited about it.
Yeah, bagels are always yummy. And I asked for chicken salad on the bagel, and I got looked at like I had 10 heads. And it took me a while to like recognize and realize, oh, because the bagel places out on Eastern Long Island, they're not really kosher at all. So it's like you have
No,
all
they're
the
they're not kosher. Yeah, they would have
yeah.
so like there's no bacon, egg, and cheese. We don't have things like
Oh my gosh. Yeah, yeah. So that was a fun experience, and it was a little embarrassing at the time, but I just laughed it off and I'm like, wow, I
no,
guess I must
don't ever be because most kosher establishments are very used to people who are not
want
Jewish or
kosher.
not observant coming in and making like it's so something we're used to. And honestly, we're always so happy to have, anyone and anyone new come in and be like, hey, like kosher food's good too.
It is. It absolutely is. So I still enjoyed, I guess I got cream cheese on it or something like that. And that was so yummy. All right, guys. So let's get into the topic of the session and why we wanted to cover this. It's been on our minds for a while because trauma is such a widely used word these days, especially online. And while we love that people are feeling more open to talking about mental health, there's also tons of confusion around what trauma actually is. Sometimes the word gets used too casually, and other times real trauma gets overlooked or minimized. And in today's session, we're really hoping to help validate what trauma could feel like, clarify the differences between PTSD or post-traumatic stress disorder and complex trauma, and offer some real insight into what healing actually looks like. This topic, of course, is a heavy and sensitive one, so please be mindful of that and take care of yourself.
Okay, guys, so let's get into it. What is trauma really? So, let's talk about the definitions of trauma. So we have like the DSM-5 definition, which is that trauma is an exposure to actual or threatened death, serious injury, or sexual violence in one or more of the following ways. That could be like a direct experience, witnessing the event in person, learning that it happened to a close member or friend, which by the way, that would be called vicarious trauma. There, it could be repeated exposure to details of trauma. So for example, someone who's works as a first responder could experience this. But then the definition is central to a diagnosis, and this is like a really important piece that we want to talk about. The definition is central to a diagnosis of PTSD. So talking about trauma as its own like entity is separate than being diagnosed with PTSD. Just because you have experienced the trauma, it doesn't necessarily mean that you have PTSD. And that's not to belittle your trauma. It's just like the same way someone can have like a really stressful, horrible situation or moment, it doesn't mean that they have an anxiety disorder, right? And so this is the same kind of concept. So just something to keep in mind. So there's a broader clinical perspective. So trauma really results from an event or a series of events or a set of circumstances that is experienced physically or emotionally harmful or life-threatening, and it has lasting adverse effects on the individual's functioning and mental, physical, social, spiritual, emotional well-being. This acknowledges that trauma is not only what happens, but how it's experienced, expanding beyond the criteria of the DSM. And you guys know Steph and I are not very gung ho on the word for word of the DSM, because human beings are a lot more complicated than the exact symptomology and time frame that is given by the DSM. As much as we love and respect it, and it has its place and it's very important to utilize, we don't always fit in these specific boxes. There also is like specific types of trauma that are obviously clinically recognized. So there's acute trauma, so like a single overwhelming event. There's chronic trauma, repeated and prolonged exposure. Complex trauma, which is exposure to multiple traumatic events, often interpersonal and early in life. And then there's developmental trauma, which is trauma that impacts attachment and the nervous system development in childhood. So just to expand a little bit on this, the lived experience um, in the definitions of trauma. So people with lived experience often will describe trauma as like anything that overwhelms their ability to cope with everyday life. Steph and I have said this endlessly. We'll continue to say this. So much of what makes a diagnosis is your ability to function with whatever it is that you're struggling with. This is a popular working definition from therapists, survivors, and somatic practitioners. It reframes trauma not by the event, but by its impact on you and on your life. Trauma is really what happens inside you as a result of what happens to you or what happened to you. Gabriel Matte's lens emphasizes that trauma is not the external event, but the internal disconnection, fear, shame, or dysregulation that persists after all. He definitely has a lot to say on trauma in addition to many other professionals. Another thing to think about is that trauma is not just what happened previously, and like I just said before, but it is also what didn't happen. So like recognize almost like a grieving process, right? It could also be something that almost happened but didn't happen. And there's so many versions of that as well. So that can also be, for example, no one coming to help when you were in need of help, no one validating a very painful, scary, serious experience. This lens would include neglect, emotional absence, invalidation, and a wide range of unmet needs. Another thing that is so, so, so important to recognize, and this is really where it goes hand in hand with somatic therapy, is that trauma lives in your body. So much of what people don't realize is that we hold trauma in our physical state. When people who experience chronic back pain, chronic head pain, different health issues, different physical diagnoses, like from somatic and nervous system work, trauma is really stored in the nervous system, and it it truly, it will affect the rest of your body.
Mm.
It's not just stored in your memories and thoughts, it's held in the different parts of your physical being. And triggers and hypervigilance are physical responses that are not necessarily chosen reactions. So this is something really important to keep in mind as you not only experiencing the mental symptoms, but the physical ones. Another thing to think about is the difference between acute trauma versus chronic trauma. So acute trauma is resulting from a single time limited intense event, and this is perceived as highly threatening or overwhelming. And again, I say perceived because every individual is different, right? So two people can go through the same thing, and one person can experience acute trauma from it and the other person might not, and that is okay. There's no right and wrong in that. Everyone's going to have a different perception of life and their experiences, and that's, that's just makes the build up of humanity. And so anything that might resemble, or excuse me, not necessarily resemble, but anything that might cause acute trauma could fall under the category of anywhere between a car accident, an assault, an attack, a natural disaster, a medical emergency, sudden loss, or witnessing something really violent, being part of something really violent, right? So this is, again, a one-time, really scary, really intense event. I always think of it as one of the things that people, that phrase where people say it was like scarred into your memory, like burnt into your memory. Um, then there's really chronic trauma. So when we think about chronic trauma, what we're really thinking about is something that occurs to a prolonged and repeated exposure to a distressing or unsafe condition. And this is especially when um, trying to escape or trying to protect yourself or trying to change it isn't really possible. And this is a very scary and very difficult part of trauma, also for therapists, because I know Steph and I've talked about this a lot, dealing with clients where they're talking to you about their trauma, but they're still living in it. Like they haven't escaped it yet. They haven't changed their situation. They're stuck. And as long as they're stuck in this traumatic experience, very little can be done for their mental and physical well-being to really improve and change. It's very hard and so painful. And anyone who is in a situation like this, like my heart really goes out to you. We see you, we feel you. Please never give up. But situations like this can be anything from domestic abuse, childhood abuse or neglect, systematic oppression or discrimination, long-term emotional abuse, growing up in an unstable or an unsafe home, right? So this isn't necessarily one traumatic event, even though there are instances in a lot of these situations where I know and I'm sure that specific memories are stronger than others, and specific moments of abuse in those situations will be more prominent in a person's mind. But this is really, again, that like more prolonged and consistent and constant state of being traumatized. I really want to clarify that not all distressing events are traumatic. So trauma equals overwhelm without support or resolution. It can also be that trauma could just be the experience of someone that didn't necessarily have the resilience, the tools, the strength, the ability to deal with that situation. And also, depending on what the situation is, a lot of it, it's like no human should have to know of such things or should understand what it's like to need to survive that. And so a lot of the time, and I've said this before, this is like you're having a normal human reaction to something completely abnormal, to something that no human should have to experience. And that's just something to really keep in mind. I think Steph and I have both experienced clients feeling like they're so like feeling like they're going crazy in their experience of trauma and all the side effects and symptoms that come along with it. And the truth is that you went through something crazy. You yourself are not crazy. And what you're experiencing as a result of a trauma or actually being diagnosed with PTSD, give yourself some grace. Like, you're human and you went through something, or you are going through something, or you've been through many things that humans shouldn't go through. And it's just something to really, really just give yourself a lot of extra love and care in holding space for yourself in that. Um, some things to keep in mind as we're having this conversation, especially if you're thinking about your own trauma and how it has developed, how it's affecting your life, how it unfolded. Think about, were you supported during that time? Did you have a safe place to land? Were your emotions validated? Did you have anyone to talk through your emotions with? Did you get help? Did you get the space to process? Were you safe? Did you end up in a safe space? Are you out of the trial? Like this, it can go on and on and on. And the differences in these answers are what really make up the difference in a lot of what happens to the person within a trauma, past the trauma, and moving forward. And just keep in mind that if the answer is no to these questions, the nervous system really can store these events as kind of like unfinished business. And that's where trauma really roots itself and sticks its nails and digs its nails into you. Because until those things are really dealt with, unfortunately, you do carry them with you, and they do express themselves in various parts of your life.
One of the things that you had said that I really wanted to emphasize was that the event overwhelms your ability to cope. So
Yeah.
something that I want to put in a very succinct way as well is that PTSD or complex trauma is a result of a processing disorder. It's an inability to process what happened to you. So it's not necessarily the event in and of themselves. Of course, the event usually is the trigger, or it is the trigger for the response or the lack of being able to properly process it. But it could affect different people differently. So, for an example, an assault in this if everything was exactly the same, one person might develop PTSD as a result of it, or complex trauma, depending on what event we're talking about, and another person might not. So it's not about the event, it's about a combination of factors: the event, the amount of support you have, the tools that you have, your ability to cope, your ability to process what happened. And that can be very different from person to person. Doesn't make someone weaker if you develop PTSD or complex PTSD or complex trauma. It just makes us all different and human. So I just want to put that out
No,
there.
I'm happy you expanded on that. Thank you, Steph.
Yeah. And also, with that being said, some of the different ways that trauma can show up, or some of the different types of events, can happen where without you even being aware of it happening. Like you might not have a recollection of the event that happened. It could have been something that you stored away, or it could have been even before your conscious memory have developed. There's stories of people who have developed trauma as a result of a traumatic birthing experience. And there's a book that I would really like to recommend from, I don't recall the author right now, but it's called Getting Past Your Past. And it really dives into the different ways that trauma and PTSD can develop, or complex trauma can develop. And it really, if you're interested in this topic or want to understand a little bit more, maybe you think that you might be experiencing one of these, but you're not quite sure. After this podcast session, I would really encourage you to check out that book, because it could be really helpful in expanding and helping you recognize that maybe something that you didn't realize might have been something that causes a stress response for you, a traumatic stress response, might actually have created that response to you. So I wanted to dive into a little bit deeper the difference between post-traumatic stress disorder, which from here on out, I'm just going to continue referring to as PTSD, and complex trauma. So just kind of wrapping it all together, this might be also referenced to as big T trauma. So the letter T, big T, that's what we normally refer to as when there's a single incident or time limited trauma. So similar to what Rachel was talking about, like a car accident, a physical assault, natural disaster, perhaps a stint in combat. And those are not an all-inclusive list. There absolutely could be other things as well, but these are some of the ways that you might want to be thinking about whether the difference between a single incident or time limited. That's going to be your big T trauma. And usually what we see in PTSD as a result of these big T traumas, and it could be one or any combination, usually, it just really needs to be one traumatic event to develop into PTSD if you struggle with the processing part of it. So some key symptoms that you might find if you do struggle with PTSD are flashbacks. It could be nightmares, hypervigilance, so like hyper aware of your surroundings and perhaps very startled at some very normal noises that might be going on around you. Avoidance behaviors, for an example, if you had gone through just a warning, a sexual trauma or a sexual assault, you might avoid the opposite sex for a while, or probably more than a while if it's developed into PTSD. You might avoid situations that you feel are putting you at risk, even though they might be very normal types of situations to be in. So that might be a way that it shows up as well. And then we have complex trauma. And the types of traumas here normally are repeated or prolonged trauma. And a lot of times it could be interpersonal. And we refer to this as little t trauma. So again, T as in trauma, little t trauma. And often we see this occurring in childhood, although it doesn't have to. But some examples of how these events might be would be abuse, neglect, growing up in an emotionally unsafe or a chaotic home, or where you were unsupported and you weren't really seen, or you were never really allowed to speak your feelings. It was maybe the mentality children should be seen and not heard. There could be a myriad of ways that could show up and affect a person's upbringing. And the symptoms here that we generally see with complex trauma are a bit different than we see in PTSD. So some symptoms that we might see is emotional dysregulation, basically just meaning you have a hard time staying at somewhat of a baseline, or when you get maybe upset, you get extremely upset. That maybe would be a higher level than someone else who might be going through a similar circumstance. And it could also be meaning that you have a hard time getting back to somewhat of a baseline. Chronic shame or self-doubt. I see this a lot when you have grown up in an unsupportive environment or have experienced an unsupportive environment, even in adulthood. Perhaps you're in an unhealthy relationship. So
Mhm.
you might really look in or turn that inward and be critical of yourself, feel shame, doubt yourself, not have a lot of confidence,
Yeah, this could
dissociate.
also come up in bullying, guys. Sorry to
Yeah.
just jump in, but I think I've spoken to a lot of clients who really don't recognize that bullying in childhood or in adulthood, believe it or not, it very much goes under this category,
Mhm.
especially prolonged bullying. So
Mhm.
just something to keep in mind because that has a humongous impact in how it shapes who you are and how you think and the traumatic experience, but definitely in regards to these symptoms, 100%.
Yeah, great point. That absolutely would fall under this category. And you might have, as a result of one of these little T traumas, dissociate. And that could be a part where you are trying to just protect yourself by disconnecting from yourself, disconnecting from the reality around you, disconnecting from your physical environment. It can also cause you confusion in your identity. It might make you feel as though you have an unstable identity, and there could be many issues that come from that, and it could develop into its own struggle in and of itself. Or you might find that you struggle in relationships, you struggle to maintain relationships, to trust in relationships. All of those can be a result of little t trauma. So I do want to take a moment to recognize that complex PTSD or complex trauma is not specified in the DSM-5. So of course we love the DSM-5. It is the diagnostic manual that is recognized within the United States, and that is within our field the diagnostic manual that we most typically are using. However, there is an ICD, and I believe we're on number 11, which is an international manual, which maybe some other professionals in the US do use more often, but I'm not very familiar with it because that's not what we use. But that is recognized within the ICD-11. So when we talk about it's just more so the differences and how they might be categorizing. The DSM is more categorical and symptom focused, and the ICD is more fluid, and it's, again, internationally adopted. The reason why complex PTSD isn't in the DSM is because people argue that it might already be covered under different diagnoses. And I do believe that there's kind of a point to this where it might fall under the category of post-traumatic stress disorder or acute stress disorder with the way that the DSM actually reads. However, because it's almost like the way that we talk about it in actuality is a lot of times when people are talking about PTSD or trauma, we normally go to the big T types of traumas. And we don't really think about the more exposure, the longer term types of little t traumas that also can develop into a trauma disorder. So that I would argue is actually a bit more within how we talk about it over just that it's actually really not covered in it. So that might be a good reason why it's not listed in and of itself. However, that'll probably change within the next DSM, the DSM-6, which I have no idea if that's even in the works or when that would be coming up. And others would also, I hope it doesn't for a while, because I'm like, it takes enough time to get familiar with this one. Big boy, it's a big book. And some other disorders that some people argue that it would fall under, mostly because of the symptoms that might be associated with these disorders, is borderline personality disorder, dissociative disorders, and that usually, again, from the symptoms, that might be more dissociation, having trouble within relationships. So a few things just to be mindful of here is, again, PTSD and complex trauma are both, of course, very valid and deserving of help. The biggest differences are what the traumatic event in and of itself or themselves are, and the trauma symptoms that develop as a result of that. And based on the manual, the diagnosis can differ. Again, if you're in the United States, you probably are going to be working with a professional that's going to be working with the DSM-5. And it's not just about the event that happened. It's about how long it happened for, how supported you were after, and your abilities and your tools to cope. And just another reminder too, or just putting it out there, that you don't need to diagnose yourself. This is not the purpose of putting this all out there, but more so that you can recognize that trauma might not look the way that you have been taught it to look. Maybe you're already aware of the big T and the little t's and how that might show up differently symptom-wise. But regardless of if you are struggling with one of these, or if you don't know, you can absolutely get help. Help is available to you, and you are deserving of help if you are finding that you might possibly fall into any one of these categories or not. If you are feeling that maybe you have some symptoms as a result of a trauma that happened to you, reach out and get help.
All right, guys. So let's also do a little bit of a dive into the treatments for PTSD, some more, and complex trauma, like some more traditional treatments, and then we'll get into, different schools of thought. But in no particular order, and we're not here to say one is right or one is wrong or one is better than the other, but CBT, talk therapy, exposure therapy, and prolonged exposure. So that could look like working through thoughts that will then connect to the emotions, that connect to the behaviors. That's classic, CBT. Exposure therapy is exactly what it sounds like, right? So we are exposing ourselves in small doses depending on what the trauma is that we're talking about. Like I've done exposures with clients who have experienced sexual traumas going back to certain, whether it was places or like putting themselves in certain situations that are needed to move on with life. And really needing to do safe exposures around that in order to move forward. So exposure therapy can be very crucial in working with trauma, um, especially with the CBT, teaching the clients to challenge those distorted beliefs, especially such a common thought that's associated with trauma of, it was my fault, or I am still not safe even when the trauma is over. Those thoughts can be very, very difficult to overcome. CBT can be really helpful with that. Especially like, introducing coping skills, relaxation, and emotional regulation tools is also incredibly useful in working with this. Common techniques when we're talking about treating PTSD, complex PTSD. So things like cognitive restructuring or thought tracking, definitely psychoeducation, with Steph and I are big on in general. We're always here that's why we're doing this podcast,
That's literally, yeah, why we're here.
We just want you, again, to be the masters of your own life and get as much education as you possibly can. Relaxation and grounding skills, which are, again, universal for so many things, just for managing life, let alone trauma. Then we can move on to I feel like this is like everyone's new favorite, but EMDR. So for whoever doesn't know what that is, it is eye movement desensitization and reprocessing. So without getting so into, because I'm not going to give an entire class on EMDR right now, but you're asked to really recall traumatic memories while engaging in bilateral stimulation. And as you do that, new thoughts and emotions and sensations will arise. And many clients generally report that the emotional charge of the memory starts to fade or shift, even if the memory remains. And a lot of people, especially people who've done it, really swear by it. They say that all the talk therapy in the world, like classic talk therapy, couldn't have helped. And then they did EMDR and poof, they're cured. And I don't particularly, at least at this point in time, do EMDR, but I've heard that it can help. So if you're feeling stuck, definitely a route to try if what you've been doing so far hasn't necessarily helped. But it can feel very intense and vulnerable and emotional, but also relieving and empowering if you stick to the therapy and doing what you need to be doing with the EMDR therapy. So shout out to all the EMDR therapists out there. You're doing great work, and potentially maybe one day I'll get into that space. Another thing to think about, classic, is medication. So here's the thing with medication and trauma. Medication cannot heal your trauma. I wish it could. I wish I could give you a pill and it was like you never experienced what you experienced. However, it doesn't work like that. So really what the medication does is it can play a supportive role in stabilizing your nervous system so that the healing is possible. So think of it as a scaffolding. It doesn't fix the structure, but it holds things in place long enough for you to safely rebuild. It really helps regulating the nervous system. So trauma often leaves the nervous system stuck in a cycle of hyperarousal, anxiety, and panic. It can be really overwhelming for the nervous system. Like we talked about before, it will affect the whole body, and the medication really can help with relieving you of some of those symptoms. Another thing to keep in mind is that, like everything else, again, it's not like a one size fits all. So if you're experiencing anxiety or panic, insomnia, or hyperarousal, that may cause numbness or exhaustion or depression. Medications like SSRIs or SNRIs or certain mood stabilizers can really be helpful with reducing intrusive thoughts and flashbacks that can come with trauma, decreasing chronic anxiety or hypervigilance, improve emotional dysregulation, and can really help it make it easier to just sleep and concentrate and just be present. But again, this doesn't erase trauma, and it helps create the internal safety needed to process it. Another really big part, as I just mentioned, of medication in general is improving sleep. And the reason that this is such a big piece, the improving sleep piece, is because trauma disrupts sleep more than almost any other condition, between nightmares, insomnias, hyper arousal at night, and it's incredibly common. And medication like pres- prazosin for nightmares or gentle sleep aids can help trauma survivors finally get the rest that their brain and their body desperately need. And without sleep, it's very hard to do the deep work of recovery. It's also hard to physically feel better from trauma, because the less sleep you get, the worse off you're going to be. Also, when you're getting less sleep, all these other symptoms get worse. So like one of the first things we really want to nip in the butt when someone is dealing with trauma. Then the last thing, well, not the last thing, sorry, one of the last things we really want to think about is creating a window of tolerance. So trauma therapy often requires you to feel like really hard things, grief, fear, shame. But when someone is too activated or too shut down, they're outside of their window of tolerance, and they're unable to process safely. Medication can really expand that window and help the survivors. It helps them stay present during therapy or tolerate distress without shutting it down completely. It can also give them access to emotions without being completely overwhelmed. Um, and just another thing I guess to think about is that this is really complementing therapy. It's not replacing it. And we did a whole episode on this with
Mm-hmm.
medication. The medication is not supposed to work on its own. We're really trying to work hand in hand here. So the medication is not a substitute for trauma-informed therapy or body work or safe relationships. It is for many survivors a bridge, something that helps us reduce the intensity of symptoms enough to access deeper healing. And discuss often what doesn't work well for complex trauma. So, like talk therapy alone, if the nervous system isn't regulated, a lot of the time, this might be an area of therapy where medication is needed for the therapy itself to work.
Mm-hmm.
If you're finding that your therapist is, you know, suggesting that you look into therapy, that's probably more common than you realize.
I love that we could talk about like complementing therapy, because therapy, obviously, we're big advocates. However, we can add more people. Sometimes it's necessary, and other times we don't have to make it more complicated than it needs to be. But especially when it comes to complex issues, sometimes we want more of a treatment team. Like I know we've talked about it before. We are eating disorder specialists. It's one of the specialties that we have. We work with dietitians, we work with psychiatrists. And when it comes to doctors, but when it also comes to trauma, we might have a different types of professionals that we're working with. So I do want to touch upon the EMDR that Rachel had brought up one more time. That EMDR is one of those therapies that can complement another therapy. Usually, you only want to have one therapist at a time. That's a general rule, because you want to make sure that you're on the same page. You want to make sure that there's not too many cooks in the kitchen when it comes to one type of treatment approach. So if we're talking about therapy, we generally just want there to be one therapist. However, there are some times where we have complementary therapies. And this is one of those cases that EMDR, because it is so structured and it's so much on its own, specifically for the trauma, you can actually be continuing your talk therapy where maybe you're talking about other issues, or you're really working on developing the coping skills so that you can better be able to do the EMDR. You can do that. And if you are looking for EMDR, and I hear a lot of really wonderful things, I've shared clients with therapists that are treating EMDR and
Mhm.
are certified in EMDR, and it could be really helpful. The thing that I would just say, as with anything, you of course are hoping that both your therapists are collaborating with each other to make sure that neither of you are contradicting the other and you guys are working complementary toward with each other.
Yeah. And there are therapists that will do EMDR and still like provide regular talk therapy. And honestly, that's the ideal.
Mhm.
Um, because I have spoken to clients who solely do EMDR, and then for whatever reason, the therapist that specializes in EMDR is kind of only doing EMDR, and some of the other things I guess, are overlooked and fall behind. So that's just something to keep in mind, and having that open communication with your therapist, that we're not like abandoning everything else. And I'm not here to judge any therapist for how they do things, especially because, again, I am not particularly trained in EMDR and all that that entails, but just something to keep in mind that, you know, especially if you're dealing with multiple diagnoses at once, that if you're doing the EMDR, you can't just be like ignoring the other things that are going on for you.
Mhm. Mhm. Yeah, and sometimes it might be if the trauma is the upfront and the thing that needs to be addressed first and foremost, and something else might stay on the back burner, sometimes that's okay because it is a
Yeah,
structured,
for sure.
generally short-term type of thing. But if it's like co-occurring with something major, of course, yeah, we definitely want to have it
Right.
at the
Thank you
same
for
time.
clarifying that. 100%.
Yeah.
100%.
Yeah. So, and something I want to spend a little bit of time on is cognitive processing therapy. So that's generally, I don't know about you, Rachel, but that's generally the type that I like to bring into
Mhm.
trauma, the way that I treat trauma, specifically for clients who don't want to talk a ton about their traumatic experience, because it's a great structure. It's normally like 12 sessions. It could be a little bit more, a little bit less, depending on the client. But it's very structured, helping you to identify what we call stuck points, which are beliefs that have developed that are holding you back, but developed as a result of the traumatic incident. And it doesn't require you giving your entire story. So it's really, really awesome if you are looking for something that might be a very structured, a very brief type of therapy. It's very intense. So if you're going to be doing that, just be mindful about that. Generally, and the best approach is twice weekly, hour long sessions. Not everyone can do that, but that is the general and recommended approach for that. So it goes through understanding how the traumatic event affects your thoughts and emotions, challenging the distorted thinking patterns that had resulted, and then reframing beliefs that have kept you stuck in shame, fear, or guilt. So I am a huge fan of CPT. That's something that I think a lot of people benefit from. But there's also, again, EMDR, trauma-focused CBT, which Rachel had touched on. And I'm going to just take a moment to mention some alternative therapies that are people do talk about being helpful and how it can be complementary, or a different type of therapy altogether. So as Rachel had talked about earlier, that trauma can absolutely live in the body. Somatic therapies are therapies that often involve what we call somatic therapists or body workers. And the belief is that just, or the focus rather, is on how trauma lives in the body and not just the mind. So some people have this belief that if there is an area of your body that there's chronic pain, it might be as a result of a certain type of trauma that had happened. So body workers can help work to relieve that in the way of working through trauma. So I am not I obviously don't do that, so I don't want to really speak out of school, but if it is something that is interesting to you, or that you wanted to explore, that is something I would encourage you to explore. So somatic therapies, it might also be, you might hear the term polyvagal theory when you're looking up this. There's also internal family systems, which is just basically using parts work to help heal the inner conflicts, like the different parts of you, and where you all have different parts that build us up into who we are. But there's parts of you that might have been shaped by your trauma, and maybe a part that's scared versus a part that's angry. And this helps to build compassion and ways to cope with the different parts of yourself that had been shaped by trauma. If you're not really into maybe some of those, or maybe not so much into talk therapy or the types of talk therapy that we talked about before. Creative arts therapy could be really helpful, like movement. Some people really process their therapy through dance or through art, or I'm sorry, process their trauma through these ways, through movement or other types of music, art. And that could be really awesome. I really don't want to talk too much about this because it really will be out of school, but there are people who do swear by psychedelic assisted therapies. So do your research for that. I am not
Yes,
recommending.
and I don't necessarily swear
Yes,
by it.
yes, yes. But to be fair, I am not. I haven't done a tremendous amount of research with it, so we are
Right.
not going out and saying, "Hey, do this." But it where we want to empower you to understand your options, and if it's something you're interested in, make sure you do your research and make sure that you do
Yeah.
it very, very safely and assisted by professionals who are trained to do this type of work. And of course, spiritual and community healing. Uh, Healing through your faith, through the faith communities, through God, if that is part of your belief system, that
Mhm.
can be tremendously healing. It doesn't have to be just a therapy room that is healing. So basically, there's not a one size fits all trauma treatment plan. What matters most is finding what helps you feel safe, supported, and empowered to heal, whether it's through therapy, through your body, the arts, or connection.
Okay, so let's wrap it up and go through some takeaways. So, trauma is not just about what happened, it's about what didn't happen after. It's about what did happen after. It's about lack of support, safety, validation, and really can leave experiences it, just really unprocessed and stored as trauma. PTSD and complex trauma are two different things. Again, PTSD often stems from a single event, and complex trauma results from prolonged, repeated harm, especially in relationships or early in life. Complex PTSD may not be in the DSM, but it is very real and very valid. And the impact matters a lot more than the label does. So just please keep that in mind. Another thing, and this should just be something that you take from this episode for all conversations, healing looks different for everybody. It's not always linear. Obviously, sometimes progress is just like feeling a little bit safer in your body that day, or having fewer shame spirals, having less symptoms. And it can take time. Give yourself some time. Effective trauma uh, effective trauma treatment isn't one size fits all. And I know we say this a lot. We say this about all therapies, that one size doesn't fit all, but it's so important for therapists to keep this in mind, that each individual is their own customized story. But it's also really important for the clients to keep this in mind, that if you are finding yourself not responding to something, we mentioned a multitude of different types of therapies. We mentioned medication. We mentioned that it could be a shorter term therapy, a longer term therapy. Don't give up if you haven't yet found, what works for you. And especially if you are still living within your trauma, it makes sense if you haven't overcome it yet. Um, Remember that if you do opt to look into medication, that it is a support. It is not a cure. It is not a quick fix to trauma. Um, and just with healing in general, you don't have to feel great to be healing. A lot of the time, healing from trauma is incredibly painful. It could be also very uncomfortable. It could be setting a boundary. It could be sitting with an emotion that you really don't want to sit with. It could be stopping yourself from totally shutting down or dissociating. And it's not always like a cozy, warm, fuzzies type of feeling at all. But just something to take away is that healing really, it is possible, even if it's slow or messy, even if it feels like it's taking longer than you want it to. You can have a life where trauma is not all encompassing and not taking over for you. And please, please, if you are living with PTSD, with C-PTSD, or any version of a trauma that you're carrying on your shoulders, you deserve to work through it and to live a life free of those traumas being carried on your shoulders for the rest of your life. So please get the support and the help that you deserve.
All right, that brings us to today's listener's question. Before we get into it, as a reminder to all of our listeners, if you would like a chance for one of your questions to be featured at the end of one of our next sessions, please send over your listener questions. You can email it to us at coffeeandcounselingpodcast@gmail.com, or you can message us, direct message or comment over on our Instagram. Just let us know it's for a listener's question. Our Instagram is at Coffee and Counseling Podcast, and we really hope that you're following us over there as well. So today's listener's question is, I want to change, but how do I stay consistent when I feel stuck? So I know Rachel has talked about this before, and I believe we talked about it before here on our podcast, that motivation is a fleeting experience. And oftentimes when we are trying to work through something, we're not always feeling motivated. So this is when this type of topic comes up, that you might not feel as though you're like ready to hit the next goal or take the next step, but you are still trying your best to put one step in front of another because you know that that's going to be something in your best interest. And what I would say, that there's probably many different ways that we can approach this, but if you are struggling to stay consistent with something that you are feeling stuck in, ask yourself, well, what would it mean if I don't change? And maybe sometimes when we are more uncomfortable with the status quo, that can help be that motivation to move us forward and take the next step. But to really ask yourself, what might be getting in your way? That might be another approach. Like, what are my barriers? What are my the things that I'm running up against? Be honest with yourself. And then it just is about getting creative to try to sidestep whatever that barrier is, or making it easier for you. So what I would encourage you is, if you are finding that you're having a hard time, try to look at it with some gentle curiosity and ask yourself, what might be getting in the way, and why am I wanting to take these steps? And that can all be parts of what can help you to take the next step. And just a reminder that baby steps are also steps, no matter how small. So maybe I would encourage you just to ask yourself, like, are you really stuck? Or are you maybe not making as massive moves as you would like to? Baby steps are still steps. All right. So we want to thank everyone for listening to our podcast session today. We encourage you to reflect on what you learn about your own experience today. And if you are in the space of trying to find a way, or curious about different ways of healing, what of the types of healing works that we talked about are you curious to try? Again, if you would like for one of your questions to be answered in one of our next sessions, please email those questions over to us at coffeeandcounselingpodcast@gmail.com, or message us at Instagram at Coffee and Counseling Podcast. If you'd like to work with one of us, you can contact us for a free consultation call. Both of our contact information is going to be linked in the show notes, and anything else we talked about today that we want to reference will be linked in the show notes as well. And we are thrilled that you joined us today, and we are hoping that you'll join us again for our next session on Tuesday.
Have a great week, everyone. See you next week.
Thank you so much for being with us today. Please follow our Instagram at Coffee and Counseling Podcast, and send any questions you have about any topic to us via direct message for a chance for your question to be featured in one of our next sessions. You can also email us your questions or topic suggestions at coffeeandcounselingpodcast@gmail.com. Make sure to check out some of our other sessions available to you right now. Once you drink up all of those and your coffee, come back next Tuesday for our next session.
The information shared in this podcast is for educational and informational purposes only, and does not constitute therapy or mental health advice. Listening to this podcast does not establish a therapeutic relationship between you and the hosts. If you are in need of support, we encourage you to seek help from a qualified mental health professional. This podcast is not a substitute for individualized care. We do offer individualized therapy. If you're interested in individual therapy with one of us, please visit our practice websites and send us an email to set up a free consultation call. All of the links and our contact info will be in the show notes.
Yeah.